Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the Ask Dr. Pane segment. Dr. Pane, this week's question comes from Instagram, and the question is, this person wants to know, do they have enough fat for a Brazilian butt lift? And more insight into the question is, they would like to have the BBL done under local anesthetic only. They don't desire to have a large butt, but would be happy with just rounding it so that it fills in the dimples and having shape so it's not so boxy. Dr. Pane, what do you suggest in this situation?
Yeah, the short answer is yes. Now, in the picture, we see somebody that's slim and has some pinchable fat around the waist there, but is not really what we would consider big or thick or heavy or anything like that. So this is somebody that's probably going to get some turn downs. We also don't have the height and weight, but my guess is the person's probably under 120 pounds, maybe 5'2" or 3" or something. So in this case, we always like to see somebody in person rather than tell them no, because we've been able to get good fat removal and better shape in almost everybody. I very rarely have to turn someone down. However, if the wish picture is a really large volume, enhanced backside that clearly is going to require more fat than the person has, I'll let them know that up front. But even in those cases, if the person has those side depressions or what I call the lateral gluteal folds and they want to enhance that, that doesn't take as much fat as the overall buttock augmentation. So short answer here is yes, the person has enough fat. The wish pick that they had showed was reasonable result, and I think they'll actually do pretty well. What I didn't agree with is someone had made a comment or a question about doing a buttock tuck where they were cutting under the gluteal fold and tucking that tissue in. That's a procedure that we do actually, and very few people do it, but it's got a select indication. And for somebody young like this, I would not advise that procedure for this person. The fat transfer is going to be the way to go, but the person should be seen in person to figure out exactly what we're dealing with and what we want to accomplish. So yes, fat transfer looks like it is possible here. Enough fat should be seen. Sometimes you have to be creative in getting it from different areas. So you always want to go to somebody that's fairly experienced with the procedure. That way you don't get turned down when you might actually be a candidate just in the right set of hands, if that makes sense. So hopefully that will cover it, and I wish them luck.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website or Facebook page by using the link below. And Dr. Pane, we'll see you on the next question.
Great. Thanks.